The Foreign Affairs Minister explains exactly how that November 1st immigration policy is expected to be rolled out. We've got the details, so stay tuned.
Officials are taking Ebola training nationwide. They've already tackled Grand Bahama and will be here in New Providence over the next 2 days, ending in Abaco. I'm Charisma Robinson. Find out the details of this story coming up in the Bahamas tonight.
And in sports, Sir Derwood Noel celebrates a major milestone. The Bahamas Tonight, the National Report, starts now.
Now in HD. ZNS Network presents The Bahamas Tonight. This portion of the news brought to you by BTC Every Day.
The immigration minister says that November 1st deadline on the newly proposed immigration policy will stand. Good evening, everyone. I'm Keishla Adderley.
And I'm Altaviz Munnings. Good evening. And according to the minister, this may represent a broad class of people, but the rules will be carried out. Janae Noel Ferguson takes a look at the national immigration plan to reduce the growing number of illegal migrants right here in the Bahamas.
Minister of Foreign Affairs Fred Mitchell receiving wide-ranging feedback on the November 1st deadline that requires all persons living in the Bahamas to have a passport or legal documentation to remain in the country. While that date still stands, Minister Mitchell revealed that there might be some leeway as certain groups have expressed concern about their passports not being processed in time.
The Haitian ambassador who raised this issue of the possible administrative delays. And we've said 3 months, so that we're hoping everybody is, in the main, up to speed by the time school opens in January. So that's the idea. We'll watch it, to make sure that there's an orderly process.
And since a significant number of Haitians and those of Haitian descent live here, many of whom consider themselves stateless, Minister Mitchell admitted that this has created a problem which cannot continue to go unchecked.
The difficulty, of course, is there's this category of persons who have not been getting status even though they were born to foreign parents. And they need to start getting the status because our Constitution does not confer citizenship at birth. They have to go to their home countries. And all of the embassies that we have facilitated, are ready to do that as of the 1st of November. You have to be certified as having been seen by an individual in the country, in your home country. And if you don't have a mission in your home country, a Bahamian mission in your home country, then to the next closest country.
And there's even more changes that will take place.
The certificates of identity that are now being issued, for example, to people who are born here to foreign parents, those, once they expire, will not be renewed, and people will be expected to go and get the passport of their nationality and again get the resident and permanent and stamp. There's a special regulation which is being drawn up and a fee to accommodate those people who are the parents of foreigners born in the country, but they don't have nationality of the Bahamas. And this is so that they can evidence the fact that they have the right to live and work here.
But what happens after November 1st? Minister Mitchell maintains that the Immigration Department is strengthening its resources to crack down on any illegals.
The department will be getting 60 new officers at the end of this month. Most of them are going to go into enforcement. There's a new class coming shortly thereafter, and most of them are going to go into enforcement. So that's what we mean to do. We mean to, track this. Defense Force, police, everybody working together. We'll keep tracking this. Right now, the detention center is full, 300 people, to the point where it's just reached capacity. So we're going to have a flight going out shortly, and then the fellas are back on the road again. I mean, this is relentless. We mean to have law and order in the place.
Janae Noel Ferguson, ZNS Network News.
Well, as you heard there, immigration officials had a very busy week, arresting an estimated 130 illegals. During checks in Carmichael Road and Joe Farrington Road shantytowns, more than 80 illegals were taken into custody. Meantime, some 12 Cubans were repatriated yesterday, while others are at the center being prepared for repatriation. They were among the group intercepted by the Coast Guard off Cat Key earlier this week. 96 Haitian nationals intercepted this week are due to be repatriated between Tuesday and Thursday of next week. Officials at the detention center say right now there are 366 migrants being held. 273 of them are Haitians.
Claims of a riot in Baintown following the shooting death of a man there on Monday night. The commissioner admitted to reporters this week that while emotions were high that evening, a select few may have acted out.
Our communities in the Bahamas are not bad places. I do not like those labels. What we have are some young Bahamian men, and I dare say even women, who are not in alignment with the laws of the Commonwealth of the Bahamas, who do not behave themselves, and they could commit a crime in any community. It is not sufficient for us to take those individual events and label entire communities. That is wrong, and most of us have come from those neighborhoods. People that live in those neighborhoods hate that stigma. And I believe that we should pay some attention to how we discuss the issues. No riot at all. And someone had just been shot and killed by someone with a gun who's still on the run. That was a live crime scene, and officers tried to bring some order. Am I making excuses for police officers? Absolutely not. Am I saying that officers should misbehave? Absolutely not.
In other news, now that workers across the health sector are receiving vital protective gear, health officials are ensuring that they also know how to use them properly. Today, they began another round of training, also integrating the evolving guidelines from the Centers for Disease Control in the United States on the management of Ebola patients or any other patients who may be contagious. Our Charisma Robinson takes a look.
She looked like she was on the scene of a science fiction movie. This woman in a large baggy white suit wore bright blue gloves with tape wrapped tight around her wrist and ankles. The head-to-toe protective gear is what first responders here in the Bahamas must wear if they ever have to face the deadly Ebola virus. And as the nation discusses Ebola preparedness, health workers across the Bahamas are undergoing training on what it takes to protect the public and themselves from the virus.
It's by following a certain guideline or protocol that has been set by your government. Again, it's looking at the borders that are open, of course, and that's really hard to really restrain because again there's the whole idea of your tourism, of course, and also then with the ports you got to have your import and exports. So with that, it's really going by the honesty of the people that are coming in, what they have been possibly exposed to, and then how are they feeling when they come in.
With the death of hundreds of healthcare workers in West Africa, local officials stressed that the National Emergency Medical Services guidelines must be strictly followed. The guidelines include a higher level of notification, limiting the number of personnel in contact with the patient, and donning protective gear.
It is a massive prevention. And again, there's always, risk involved at all times. It really, doesn't matter. But the thing is that looking at how can we best prevent it 99.9%. So by education and showing them how to do it, that's our goal.
CDC guidelines say just as important as putting the protective equipment on is taking it off.
Because remember, she's already been sprayed down really good. So that's the part of the, disinfecting now, okay? So now go ahead and peel out of your suit. And you're going to take it all the way down through your boots. Now, whatever your guidelines and protocols are, typically the boots are gone incinerated. Okay? I know that can be an expensive thing, but do you want to spread cooties? Probably not. Okay? So, all intents and purposes, though, for the training here, we'll just pull that down. Go ahead then, and good. You see how it's inside out.
The Ministry of Health has determined that the Fox Hill Clinic in New Providence is the designated location for extended isolations and management of Ebola cases. Any EMS worker who is exposed to blood or bodily fluids from a suspected or confirmed case of Ebola should seek medical attention promptly.
You don't want to have any panic or hysteria because there's really no need for that because, again, that just causes mass confusion. So with that, education and just understanding.
Officials are taking Ebola Ebola training throughout the Bahamas. They have already tackled Grand Bahama and will be here in New Providence over the next 2 days, ending in Abaco. Charisma Robinson, ZNS Network News.
As the global society joins forces to combat the spread of Ebola, a Caribbean nation is offering its support with teams of doctors and nurses. Already, a Cuban brigade of medical experts is on the ground at the core of the Ebola crisis in Africa. And to prevent the spread of the disease into places like right here in the Bahamas and the region, Cuba is offering its medical expertise to this country. Its ambassador views this move as essential, as an Ebola outbreak could be devastating to the lifeline of the region. Tonight, Betty Thompson-Moss has more on Cuba's initiative to help fight Ebola.
Already providing medical supplies and healthcare workers to Ebola-stricken nations, Cuba is ready to help with training for Bahamian healthcare providers and others on the front line to stop a local spread of Ebola.
Of course, Cuba is open to offer our help to any Caribbean country as a priority, as the member of the ALBA TCP groups, including, of course, the Bahamas. So we will be more than pleased to exchange information, to train Bahamian medical doctors or nurses or not medical staff.
Cuba's ambassador, His Excellency Ernesto Guzman, says this training could target key areas like Bahamian ports and air arrival centers to prevent an impact on the country's tourism sector.
Cuba and the Bahamas, we have to take control of our border. For example, we receive a lot of tourists every day. So we need also persons in the airports, in the ports, prepared to deal with the persons that arrive in our country every day.
Already back in Cuba, a high-level team has met at the Havana summit on the Ebola epidemic. A key decision was made to address as priority the special needs of sister countries in the Caribbean.
The worst scenario will be that the Ebola enter in the Latin American and Caribbean countries, So first of all, we have to help African peoples to deal with that because Ebola is already there. So we have to help them and to try to resolve the situation in Africa. And at the same time, we have to work together in order to avoid that the Ebola comes to the Latin American and Caribbean countries.
Cuba continues to get high praises for its Ebola initiatives and its free universal health care and medical advances. And this advancement could also lead to further research right in Cuba for a vaccine and medication for Ebola. Betty Thompson-Moss, ZNS Network News.
This portion of the news is brought to you by Shell Ultra Low Sulfur Diesel.